Good morning, everyone, and thank you for joining us for the Health and Human Services Committee Wednesday, January 12th meeting at 10 a.m. Actually, it's a little bit later than that now, but 10:18. Wanted to thank everyone for their patience while we experienced some technical issues. Also wanted everyone to know that this meeting will not be live on YouTube right now. Instead, it will be recorded and uploaded to YouTube after the meeting. Do we have any changes to the agenda?
We have those two revised resolutions.
Okay, if everyone could take a look at their revised resolutions. For both of those resolutions, there were some dates that were added for the fiscal years. I would like to change the order a bit. I would actually like to move the resolutions up to the top of our agenda so that we can pass those. I know that we do have a legislator that will need to head out soon due to another commitment. Katrina, do we have anyone here for public comment? We have no cards and no one is here in our chambers for public comment. And next, let's go ahead and do our resolutions. These are resolutions from the Health Department. First resolution, designating the Community Development Block Grant Environmental Certifying Officer, Environmental Health ID 10629. Can I have a mover, please? Moved by Mike, seconded. Henry, was that your hand? Seconded by Henry. And Frank, would you be able to talk to this resolution, please?
Yeah, I believe this is to, it's a requirement of the CDBG grant on the septic system replacement funding we received that we have to have an environmental officer, and we're designating Liz Cameron as that person.
Thank you. Are there any questions for Frank? I see none. Let's go ahead and do a roll call. Mike Sigler?
Yes.
Amanda Champion?
Yes.
Veronica Pillar?
Yes.
Henry Grennison?
Yes.
And I am a yes. That's unanimous. Thank you, Frank. Next resolution, budget adjustment, New York State Public Health Core Fellowship Program, Public Health 4010 ID 39. If I can have a mover, please. Moved by Veronica, seconded by Sigler. Was your hand up? Okay, seconded by Sigler. And I would also remind everyone to please look at the revised version. And the change was adjusted for fiscal year 2022. Frank, can you tell us about this resolution?
Yeah, we finally got our contract approved from the state for the fellow program. And so this is the budget adjustments in order to align that appropriately in the budget.
Thank you very much. Any questions for Frank? Amanda?
Yeah, thanks. I'm not sure if my question makes sense, but sorry, and I'm going between screens looking at the resolution. But so I just wanted to confirm with this one and the next one, that amount in the first line, is that all what we're getting? 1,111,000? We're getting all of that.
Correct. We get all of that to administer and employ the fellows in the program.
Okay. All right. Just wanted to make sure that was clear for me. Thank you.
Any other questions for Frank? Henry?
Yeah. Yes, Frank, we're getting all of that, but we're only doing what comes in fiscal year 22.
Correct. This is a 2-year program that started back in July of 2021. So yes, there will be funding that will be used in 2023 for at least 6 months.
Okay, was there also funding used in 2021 or not?
No, because they just approved our contract. So we lost 6 months of the 2-year program, unfortunately.
Oh, okay. Thank you.
Any other questions for Frank? I see none. Let's go ahead and vote. Roll call, Mike Sigler.
Yes.
Amanda Champion,
Yes.
Veronica Pillar,
Yes.
Henry Grannison,
yes,
and I am a yes. That's unanimous. Thank you. Next and last resolution for the morning, budget adjustment, COVID-19 ELC school grant, Health Department 10641. If I can have a mover, please. Moved by Amanda, seconded by Veronica. And Frank, if you could talk to us about this resolution.
Yes, the ELC funding is the funding we received for school testing. So that program has been in operation since about the beginning of the school year. So some of the funding was spent in 2021. And this is putting the remainder on the books for 2022.
Thank you. Any questions for Frank? I just want to say that this testing in the schools has been really helpful. All three of my kids are signed up for it. At one point, they were going weekly for it. And I know that in Northeast DeWitt and Ithaca High School, it has certainly been able to catch some positives. So we're certainly thankful for the $2 million. Let's do a roll call. Mike Sigler,
Yes.
Amanda Champion,
Yes.
Veronica Pillar,
Yes.
Henry Grannison,
yes.
and I am a yes too. Thank you, Frank. Frank, would you actually like to go ahead and do the health department report for us?
Sure. We're a little out of sync. Normally these meetings are right before a ledge meeting and we're prepping for that presentation. But generally speaking, there's a lot going on with guidance changes. I think everyone's aware, both at the federal and state levels. And unfortunately, it's created a bit of confusion. We've tried to add some clarity where we could. We're still expecting guidance on the announcement the governor and commissioner made yesterday around contact tracing in preparation for standing down those operations. But we need the actual guidance. I'm not clear. What they've been telling us is coming in guidance has some nuance to it that was not really voiced yesterday in the press conference. And so, as we have throughout the pandemic, we really have to wait till we see it in writing so we can then implement it. So the PIO group is working, prepping information based on what we know. And as soon as we have clarity on that, we'll be providing more information to the public. The one thing I do want to point out, because many counties around us have talked about standing down contact tracing already. And it's often cited that they're overrun with cases. And while certainly that's a component of it, it's not the only reason to suspend most of contact tracing. What we know about Omicron is, one, it's highly transmissible. Two, it's transmissible up to 2 days prior to the onset of symptoms, and that generally it's within the 2 days prior and 3 days after the onset of symptoms. So people are already transmitting before they even know it. And with the shortened isolation and quarantine period down to 5 days, because we know people are most transmissible during those early days, the effectiveness of contact tracing is diminished. In this instance, case investigation and contact tracing is a critical tool with communicable diseases, and we've been using it successfully for a couple of years. But as the disease has evolved and our approach is, it's becoming a less effective public health intervention. And so really, we're going to be standing that down in an effort to put our energies on things like vaccinations, working closer with our senior populations, the folks that are most vulnerable and at risk. So really, we're just shifting to what we think will be more effective in protecting those that are most vulnerable. So I don't want folks to think that it's simply because we just have too many cases, we can't do contact tracing anymore. That's not the reason to stop contact tracing. If that were the case, we would look for more resources and try to continue to do it. Really, the science around the disease is what's driving that shift at this point.
Thank you, Frank. Are there any questions for Frank? Mike Sigler?
Hi, Frank. It's interesting what you just said about contact tracing, going by the wayside because it's basically become less effective. Do you think we can expect to see that with some other measures, in the coming months?
So, yeah, I think over time, of course, hopefully we'll get to the point where there's no specific COVID public health measures other than our, traditional stay home if you're sick, cover your cough, wash your hands often. The challenge that we have is as we stand down contact tracing, that's one layer of the Swiss cheese, right? We've been talking about that Swiss cheese for months. Everyone's seen the little drawing. That's one layer of the Swiss cheese that's going away. So we have to keep some of the others in place a bit longer to see what the impact is, as we move forward, right? So masking, particularly on kids in school, I know is a question that we get all the time. For the time being, we need to continue that and see what the impact of these other changes are. And then ultimately, again, as the disease evolves and our understanding about it improves, there will likely come a time where those other interventions can be stood down as well.
Amanda Champion?
Thanks. Frank, I've heard like on the news that they say that the little blue surgical masks are not as effective for the Omicron variant. Is that true? Should people all be wearing N95s now? What's your opinion on that?
Yeah, it's a difficult question, right? So we should go all the way back to the beginning when we started talking about masks, right? When we asked everyone to put a mask on, they weren't necessarily designed to be protecting the wearer. They were to protect everyone around them, right? The way I liken it to is we've been taught since we were young children, if you sneeze or cough, cover it, right? It's the same theory. If you're expressing something and that's what's transmissible, if there's a barrier of some sort between it and the other people, it's going to limit how much exposure they have. It's not perfect, it's not 100%, but it's an added protection, another layer, in that Swiss cheese. As we're learning more about Omicron, it is more transmissible. We know that. And so if we start talking about the wearer, and obviously if you wear a cloth mask, it does provide some level of protection too for the wearer, but it really was designed for protecting others. And it, of course, isn't perfect. N95s and even the KN95s, they're designed to be worn by people that have been fit tested. Right. And so if you wear an N95 mask for your employment, there's a process that you go through to make sure you have the right mask. There's different manufacturers, different types that fit your face structure and all of those things and are protecting you. So they can provide additional protection for the average person. They are designed to be done with a fit test if they're actually going to provide the level of protection that they say they do on the box, right? So is it better to have a well-fitting mask? Absolutely. Absolutely. And so the CDC has guidance on what a well-fitting mask should look like. And there are different ways to achieve that. KN95s are one approach. Wearing a well-fitting cloth mask with a brace over the top, wearing a mask that's tight against your face that has a nose piece is helpful. All of those things are additional steps around masking that can help the wearer be more protected, right? None of them are 100%. We should be clear about that, right? Even the N95s aren't necessarily 100% when worn after being fit tested. So it's just added layers. What I would encourage people to do is take a look at the CDC website. There are different ways and different types of mask structures that they offer that can give added protection.
Great. Thank you for all that.
Sure.
Great question, Amanda. I was wondering the same. Any other questions for Frank? Okay, I see no hands. Thank you very much, Frank, for helping us and answering our questions. Let's move on to our appointments. We have 2 advisory board appointments. First one is for Developmental Disabilities Subcommittee, Sheila McHenry, Mental Health Community Services Board Representative, and her term expires December 31st, 2025. Second is the Substance Abuse Committee, Mandy Kagi, Community Member, and her term expires December 31st, 2025. Can I have a mover, please? Moved by Henry. If I could have a seconder. Seconded by Amanda. And any questions or comments? If needed, we can also go into executive session to discuss these candidates. I see no comments or questions. Let's do a roll call. Amanda Champion,
Yes.
Henry Grandison,
Yes.
Mike Sigler,
Yes.
and I am a yes as well. 4 yeses. Okay, let's go ahead and do the county administrator's report. Welcome to our meeting, Lisa Holmes.
Thank you very much, Madam Chair. Under County Administration's report, a few items. We just finished a department head meeting prior to this meeting. And we've instructed departments to compile their 2022 departmental goals by the end of this month, share them with county administration, and then report them out to their respective legislative committees in February to help ensure alignment between legislature committee goals and departmental goals, and just for the purposes of information sharing. So legislature is aware of what's on our department's workloads and plans for 2022. Also, our departments look forward to working with the new incoming legislators, and will be, I've shared with them that they will be getting in touch with them in the coming months to schedule an orientation to their respective departments, and hopefully they can schedule those as a group of 5 wherever possible. And then in other news and other updates, we received last week a delivery of test kits from New York State, about 4,600 of them. New York is prioritizing those deliveries to go directly to schools through BOCES, but these were for community distribution, and we've been told that we will be receiving more for future distribution. This shipment went to the municipalities for distribution in their communities, and for people who may have trouble or lack the means of purchasing through pharmacies. And there was a small allotment designated for shelter clients and staff. We anticipate the next delivery when we get it, and when we understand how much is included in the delivery, which we're never sure when and how much ahead of time, will be delivered through the food pantry network and library systems. And I think that's about it for this update.
Thank you, Lisa. Any questions for Lisa? Okay, I see none. Thank you, Lisa.
Thanks.
Let's do our minutes approval. If I can have a mover for our minutes approval for December 20th, 2021. Amanda? If I could have a seconder, please. Seconded by Henry. Any questions or comments? It's hard to think that that was last year. Okay, let's go ahead and vote. Amanda Champion,
Yes.
Mike Sigler,
Yes.
Henry Grandison,
Yes.
and I am a yes. Thank you all. Next, let's go to the chair's report. And I'm actually going to combine the chair's report with the report and discussion of our 2021 committee goals. This is sadly going to be my last Health and Human Services Committee meeting as chair. I just want to thank all of our committee members for being committed to this, this process and coming to our meetings and adding your input. We have had a pretty full year, and my guess is that in the upcoming year, it's probably going to also be extremely busy. And I just want to thank all of the staff that have also taken notes, all of the department heads that come to these meetings and have helped us along the way. Let's go ahead and go to our 2021 Health and Human Services Committee goals.
Shauna,
Yeah, go ahead, Amanda. Sorry.
I just wanted to thank you for chairing this committee for so many years. I mean, you've been doing this since the beginning, right? Since you first came on. So you've been a great leader, and I really appreciate everything that you have put into making sure this committee works and that we hear everyone's voice. And yeah, so thank you.
Thank you, Amanda. I definitely feel like this has kind of been my baby for the past 4 years. So I'll be handing it delicately to the next chair. Thank you for that. Okay, the committee goals last year's, we could see how successful we were. For the Office of Aging, provide outreach to the senior population and communications for testing and vaccination options. Continue to assist seniors in our area and navigate through the process. Let's see here. Is Lisa Monroe here? I am not sure Lisa is here.
I'm here.
Oh, there's Lisa. Lisa, how you doing?
I'm good, thank you.
Good. How did we do on our goals?
I think we're doing it.
Hey, there we go.
Yeah, we're doing it. You know, that's really been our focus pretty much the entire year. So, and we're still getting calls as far as vaccination and boosters and things like that. So we're really assisting people with whatever they are calling us and needing at this time.
That's wonderful. I'm especially grateful that our committee gets to take responsibility for the success of this goal. So thank you for that.
Absolutely.
Thank you, Lisa. And do you have any updates or departmental announcements?
The only thing I was going to mention is, I just mentioned this at department head meeting too. Our long-term care ombudsman department in our office is recently just completed certification training for new volunteers. And we will have 6 new volunteers starting to have a more regular presence in the nursing homes. So there'll be 10 certified ombudsmen that will work in Tompkins County in the assisted living and nursing home areas. So we're still, you know, navigating through the visitation process with the changing guidance and, you know, what's required for our ombudsman to go in and the testing and everything associated with that. So that's a big thing. We have not had 10 ombudsmen. I don't recall if we ever have had 10 in the county. So that's really great right now.
That's wonderful. Any questions for Lisa? I see none. Thank you, Lisa.
You're welcome. Thank you.
Office of Human Rights, Reverend Ken could not make it this morning. He's not feeling well. And he did provide, let's go over his goals first. Provide monthly presentations and outreach to our community that are time sensitive and educate the public. Continue to provide counseling and reporting for fair housing and non-discrimination in Tompkins County. Conduct a deep dive of the number of human rights cases from Tompkins County being filed with the New York State Office of Human Rights to certain if Tompkins County should revisit the state with an MOU for limited case conciliation. So I'm not sure what the update for this office is. My guess is that we could follow up in the February meeting and see if the committee goals were established for the Office of Human Rights. Ken also sent an email today with the update for his report. And he wanted to state that he is preparing for the K through 12 Human Rights Art Competition Awards event on Saturday, the 5th of February at 10 a.m. They are working with Dominic to plan and promote a virtual event. The deadline for submissions of poetry, art, video, spoken word by the students is this Friday. They will be enlisting members of the Human Rights Commission to serve as judges of the submissions and to select the first, second, and third place winners in each category. Any questions or comments on the Office of Human Rights? I'm not sure who would answer those, but we could certainly ask some questions if we want, and I'm happy to email Ken and try and find some answers. Okay, I see no questions. Thank you. Office of Veteran Services. Is JR here? Oh, there we are.
There we go.
Hello, JR.
I'm here.
How you doing?
Good morning and Happy New Year to everybody.
You too. For your goals for 2021, we had continued promotion and outreach to veterans and help them through the pandemic, which was a massive goal. And I have heard out there that you have done an absolutely incredible job. So thank you for that.
Thank you. I'm trying.
Great.
Hey, yes, I do want to say that I really want to thank a lot of the folks in the community. I mean, this is definitely being a one-person department. I can only do things with working with others. And this past year, I think probably the bigger highlight was just working with a team of folks for Veterans Week, which instead of Veterans Day, we were able to extend it into a week with a special nod to facilities and Arel and his crew for helping greenlight the community. And I mean, our facilities, our county facility buildings, as well as Dominic for getting us on the radar with NISAC, because when they promoted it, Tompkins County and the old jail actually was one of the first pictures on the NISAC's website about Operation Greenlight. So that was kind of a cool little boasting point for us.
That's great. And it's been interesting because I've been driving around the county and every once in a while I do see people that still have their green lights out. So that's really nice to know the meaning behind the green light, aside from it being Christmas. But I like to think that there are a lot of green lights out there. Any questions for JR? I see none. Thank you so much, JR.
Thank you, everybody.
Take care. Have a good day. Okay, next is youth services. Continue to provide municipal coordination of services that align with results-based accountability goals. Hello, Kate Shanks-Booth.
Hi, good morning and Happy New Year. Yeah, we've continued to work with our municipal youth services in all of the different municipalities. We've incorporated our vitality checklist, really including them in the goal setting this year. And we've had some really great conversations. We've also, we're working towards doing the RBA goals. Hopefully by the end of 2022, we'll have that shift made. And we've done some diversity and equity training with them, which was the first time we've been able to provide training to that particular group and had a great turnout on that. So a lot of exciting things have been happening.
Great, thank you. Any questions for Kate? Okay, I see none. Thank you, Kate.
Thank you.
Next is Department of Social Services. Continue to provide services through COVID while training a new workforce. Quarterly updates to be provided on the eviction moratorium and Code Blue. The committee will follow effects of state and federal government's decisions and how it will impact social services locally. And I believe I saw Deana here. Hi, Deana, how you doing?
Hi, good, thank you. Glad to be here. Yeah, so we've been tracking things with changes with regard to the eviction moratorium, that sort of thing. So I'm going to kind of roll in some updates with on the goals. So the current moratorium is scheduled to end on the 15th this weekend. We have not heard anything so far that it's being extended. So our staff, we're starting to prepare for, we're not sure how many people we'll have showing up because there's been the ERAP program. And I know there's been at least, I think over 100 households or more that have been assisted with that. We do have ESG and STEP funds that can help with rental workers. So if people are coming in, we do have resources to help folks with that. So we'll just, and we can coordinate some of that with some of the arrears money that DSS can have through traditional programs. Let's see, the other goals, we've hired a lot of new staff. So we had a number of retirements. We had different folks leave during this past year with just what everyone in the community is experiencing with decreased staffing. I think our children's services, we've hired, I think 4 or 5 new caseworkers in the past couple months. And so working hard to get them trained. The state is still doing online training, so that makes that feasible for us. And then we've also hired a number of staff in our eligibility. And again, with online training, we're able to get them up to speed. Did I cover the goals? I didn't. I got the COVID and staffing ones and the quarterly reports. Was there another one?
No, I think that was, the last sentence was committee will follow effects of state and federal government decisions and how it will impact social services locally, which I
Yes.
figure you just do as they come in.
Yes, yes.
Okay.
So a couple other updates. So with the increase in colder temperatures, we've had an increase in the number of folks in shelter in code blue. So we had a total number of 116 people in the shelter the past couple of weeks. 74 of those have been code blue. So a lot of people coming in with the colder temperatures. We've been having an increase in the number of people applying for temporary assistance in SNAP cases. So our staff are working hard to keep up with that. And then I just wanted to let the committee know there's a new program that New York State has put out. We just got information a few weeks ago. It's called the New York Rental Supplement Program. So it's across the state. The state is giving allocations to districts to provide supplements, rental supplements to low-income folks for a 12-month period. We're still waiting for some guidance on a number of questions we have about how to implement it. Each district makes kind of develops its own eligibility and process for that. So as soon as we get our questions answered, we'll be putting together that program and plan, which we'll send to the state in mid-February. And realistically, so it needs to be approved before we can implement it. It'll probably be later in the spring that we would actually implement it. And so Kit will probably give you more details on what that looks like in February and March.
Great. Deanna, would you be able to, once that is approved by the state and we start to roll that out, is there any way that we can get some marketing materials, some media materials, so that all of our news outlets can have access to that and get the word out?
Yes, definitely. We'll work on that.
Great. Thank you. Henry Grandison has a question.
Yes, thank you, Deanna, for your report. I was wondering in terms of the ERAP program, I know that New York State ran out of money, but then there was also a request for more money, and then the Fed seemed to give more money. What is the exact status of that program right now?
We haven't gotten an update yet. So our last meeting with OTDA, I think, was back in December, and they were still waiting to hear if they were going to get any more funds from the federal government, but we haven't gotten any more information on that.
Okay, thanks.
Deanna, are there expected to be people that are currently residing in a housing that after the moratorium ends this weekend, you would expect to be unhoused?
I don't know that they would, I don't know for sure. I guess I'll say that. I would think that there's going to be some process that's in place. I know Law New York has gotten a large amount of funds through a couple of different sources to increase their legal staffing. So I think if somebody is facing it, you know, somebody, landlords looking for immediate eviction, they could contact Law New York and probably get some, be able to get some assistance in deferring that until they can maybe access other programs to help with arrears and that sort of thing.
I guess my concern is that with the temperatures being as low as they are and the eviction moratorium ending this weekend, I would hate for people and families to not have housing, especially this weekend whenever our offices are closed and you know, there's really no one to have access to. Is there
So yeah, so
some type of
if somebody is in that situation, so St. John's will house people. If somebody comes in when our offices are closed, St. John's will address that. And especially with Code Blue, we would be able to help people immediately. I think
That's
our-
great. I just wanted to put that out there and let people know that if they do find themselves unhoused, that what is the protocol right now? Do they actually go to the shelter or make a phone call?
They could probably just make a phone call. And of course, I don't have the number off the top of my head, but certainly going there too if they need to. And again, if people can, I guess I would encourage, if people think that's a risk, to maybe contact New York Law on Friday and see if, because I think we just met with New York Law and our other ESG partners. Housing is so difficult in our community that any way we can keep people in their current housing is always the preference. And so anything we can do both through legal services and seeing if people are eligible for payment arrears is really what we want to focus on, because once they've lost housing, it's a real challenge these days to access new housing for folks.
Great. Thank you, Deanna. Mike Sigler?
I just wanted to ask a question about the eviction moratorium is as Shauna said, is ending this weekend, but that doesn't mean, Deanna, that all the rules about eviction go out the window, right?
Right, no, yeah, that's kind of what I mean, is that people still have recourse and options with regard to legal rights and that sort of thing, so.
All right, thank you.
Any other questions? Okay, I see none. Thank you so much for coming to our meeting today.
Thank you.
Okay, next is public health. Continue to coordinate with providers to provide our community with testing, vaccination, and efficient contact tracing. Focus will continue to be on active communication to our constituents. Explore with the relevant staff the feasibility and potential implementation of a mobile vaccine clinic that can be rolled out seamlessly for both flu and COVID vaccines. Hi, Frank.
Hi, Shauna. Yeah, I mean, I think you guys know where we are on things at this point. Vaccines are shifting to our priority now. Obviously, when we wrote that, it's hard to even imagine what we were thinking when we wrote that compared to where we are now. But certainly on the vaccine front, homebound appointments are starting this week and will be continuing throughout the month. We have another clinic at the mall scheduled for Saturday for boosters. We're going out to Dryden, Enfield, and BJM next week to do more 5 to 11-year-olds. And then we'll be looking at boosters for the 12 to 17-year-olds from there. So yeah, we're still focused on vaccines as a primary mechanism to help us fight COVID. And I talked earlier about our contact tracing shifting and what's going to happen there. I think broader, there's some important things from a public health perspective that, quite frankly, we probably didn't imagine we'd be able to do this year that were accomplished, like continuing forward with the public health mental health merger. A lot of work has happened with administration in the two departments and bringing those two things together in preparation for a joining of the chart of accounts. Staffing has been recruited and brought on board for that. We completed our strategic plan in 2020 and have been implementing a portion of that in 2021. And so there's efforts ongoing around integration of services, as well as what our identity will be going forward. So there's been a lot of positive movement there. Our quality assurance and health promotions teams have been working close together, looking at getting information out more effectively for both sides. And a lot of work has gone into updating our website as well. And I'm happy to announce that we're actually now starting to see some changes to the mental health webpage with additional information, thanks to our web team on doing that. So yes, we've been focused on COVID, but we've also been doing other work as well. Each of the divisions has been focusing on other things too, probably more than we want to talk about here today, but I just wanted folks to know that while COVID has been the priority, we are, keeping our eye and maintaining the other necessary services as well.
Great, thank you, Frank. Any questions for Frank? Okay, I don't see any hands. Next is mental health, hiring and onboarding new mental health staff and providing monthly updates on mental health services in the county.
Probably have
Just
not been
rolled
doing.
over to 2022.
Yeah, and I probably haven't been doing a good job of giving you the updates that you might have wanted. I think the clinic and our pros program has been doing yeoman's work of trying to meet the demand in our community during what are very challenging times. We have converted back to providing in-person services in conjunction with telemedicine. So that's been a challenge this year of trying to figure out how to logistically make that happen. We've struggled with staffing issues. We've talked about that in previous meetings. We're putting a lot of energy into recruitment right now, primarily focused on getting positions filled so we can reopen all of our intakes. Obviously then we need to have a recruitment plan for the future to continue to both expand services and maintain what we currently have in place. So hold me accountable. We'll try to make sure that we're giving you the updates that you want about what's going on with the services at the department this year.
Thank you, Frank. Any questions? I see none. And Human Services Coalition, continue to support the community members through the pandemic through HSC navigators, workshops, and compassion and fatigue training. Hi, Kathy, how you doing?
I'm good. Hope everybody else is doing well.
We're doing great. Thank you.
We have done a number of trainings this year. We've worked a lot individually with agencies to try to get them the training that they need. We just got funded through a park grant. We got two actually park grants. One is to do leadership development in agencies that have leaders of color. And we got a grant to help, actually we call it the Get Out of Town grant, which is not exactly pertinent for right now, but it's so people and agencies can start going to conferences again and making those networks that have been just ripped apart kind of during the past 2 years. So we have done that. We still have our navigator program that has been, really worked hard this year to help make sure people who were losing their job or being laid off still had health insurance. Of course, that 211 has just been taking calls like gangbusters. They took over 28,000 calls last year, which is up from a normal year of about 12,000 calls. So, and I know Deana talked a lot about this, but our housing programs, of which we were running a number of them this year, are really kind of geared up for the end of the moratorium. We will have staff at the eviction courts to be provide, connect people to services. And we're also working closely with Law New York. We know, unfortunately, that a lot of people that, we had a couple of housing programs. We were helping with the ERAP program that no matter how you try to get them, they will wait till the actual moratorium ends to seek out assistance. So we know that there's going to be, the worst time of year to have to be, looking for housing or to be homeless. But that's when the moratorium's ending. So and we're pretty sure it's going to end. I think the governor even stated that she was not going to extend the moratorium. So so that's kind of where we are now. We do know that we have been calling a lot of the people who apply for ERAP, that even at the state, they haven't really caught up with the applications. yet. So people, a lot of people are just waiting to hear. A lot of those people aren't going to get funding, but we've been trying to help them understand where their application, is. Is it, still in progress? Have they been denied? Are they waiting for more information, or, the status of their application so that they can plan accordingly? So, and we know that some of the people have had to leave their apartments even while they were hoping to get the ERAP. So we've been working with them also. So that's kind of it.
Kind of it. That was a pretty great update.
It's been a crazy year. And just in case in case they're wondering, the final interviews for my position will be held later this month. So that is also moving along.
Oh, Kathy.
I know.
We just want to say that your agency has really been absolutely incredible stepping up during the pandemic. It is so nice for legislators to be able to give their constituents or people in need the 211 number. It's a one-stop shop for so many people, and we really thank you for that.
Been our pleasure. It's been a crazy year, but we're glad we're here and we could do it. So
great. Well, thank you.
Thank you.
Are there any comments from committee members or liaison reports? I see none. Let's go ahead and adjourn this meeting. If I can have a mover to adjourn. Moved by Mike Sigler, seconded by Amanda Champion. And let's do a quick roll call. Amanda?
Yes.
Mike Sigler?
Yes.
Henry?
Yes.
And I am a yes. Thank you all. Have a great day.
Thank you.